Good afternoon, everybody. I am Dr. Anirban Biswas and I am a diabetologist practicing in South Delhi. And today we are going to discuss about screening and diagnosis of pre-diabetes and diabetes. Friends, most often some of my patients send me or tell me the reports that they have a fasting sugar of 128 and a PP sugar of 142. So, whether they are diabetic or not. So, by listening to today's topic and lecture, you will be understanding that whether you are diabetic or not. So, first of all, let me tell you that diabetes is a dreaded disease, and India, as you all know, is a diabetic capital of the whole world. And every 7 seconds, one person die of diabetes in this world. So, it is a very big, huge burden which is upon us, and most of the diabetic care and the treatment is borne by the patients in India, and on average around 10,000 rupees per year is the annual cost of treating diabetes without any complications. So, it is a huge amount. So, we need to find out whether you have diabetes or not. So, the first thing is that if anybody can have diabetes, yes, anybody can have diabetes. There are symptoms of diabetes like weight loss, lethargy, thirst, excessive urination, but often diabetes is silent. So, it is better to screen the patients. It has been found out in various researches that half of the population does not know that they are diabetic, not in India but also in US. So, it is very important that we find out that who are diabetic. So, there is a very simple way by which you can find out that whether you are diabetic or pre-diabetic or having normal blood sugar level, that is you are normal. So, now the values that I am going to tell you, that how do you know that you are diabetes. So, first thing is that is fasting blood glucose. It can be done in any lab. So, you go in the morning without taking any meals, and the number you have to remember, if your fasting blood glucose is less than 100, that means it is normal. If your fasting blood glucose is between 100 and 126 milligram, that means you are pre-diabetic, having a higher risk of getting diabetes later on. And third, if you have fasting blood glucose more than 126, that means you are a diabetic patient. The other way to diagnose whether you are diabetic or pre-diabetic is HbA1c level. HbA1c is also known as glycosylated hemoglobin, again a routine test which is done in all the labs. The values you have to remember, if the HbA1c level is less than 5.7, you are normal. If the HbA1c is between 5.7 to 6.5, you are pre-diabetic, and if the HbA1c level is more than 6.5, you are a diabetic patient. The other test, third, is OGTT, which is done in certain cases where there is still some amount of doubt. So, oral GTT test is by means 75 gram of glucose is fed to you and the sugar is checked after 2 hours. So, it is a you can say a postprandial sugar level after feeding with 75 gram of glucose dissolved in water. So, after 2 hours of feeding the glucose, if the sugar level is less than 140, you are normal. If the level is between 140 and 200, that means you are pre-diabetic, and if the value is more than 200, that means you are diabetic. So, which individual should get screened for diabetic and pre-diabetes? Any individual above the age of 40 years, and from your weight and height, anybody can calculate his BMI. BMI is equal to first you take your weight and then you divide it by the square of your height. It can be, there are so many formulas, but this is the widely accepted formula, and by which you can calculate your BMI. If the BMI is more than 23, then you should get screened for diabetic, even if you are not 40 plus in age. Any person who is having symptoms of diabetes, any person who has a close relative or blood relative like parent, aunt, uncle of any side, maternal or paternal, or even the sibling, if they are having diabetes or pre-diabetes, they should go and rule out their diabetes. And last but not the least, patients who are having history of GDM, that is the pregnancy induced diabetes, which is common in females throughout the world, and they should, after their pregnancy or delivery has been done, they should get regularly screened for diabetes. So these are the persons who should get screened for diabetes, and by getting screened for diabetes we can save ourselves from the complications of diabetes. Diabetes can cause so many complications. Most important are the cardiac or the heart related complications. You can get stroke, you can get MI, that is heart attack, you can have neuropathy, you can have kidney failure, you can have blindness, that is retinopathy, and you can have all sort of other problems related with diabetes, including amputations, that is any organ like your leg or your arms need to be cut because of a diabetic ulcer. So friends, with this I conclude. Maybe you have learned something from my talk, and please remember that you should get yourself screened for diabetes if you are falling into any of the categories. And next time we will discuss about the types of diabetes. If you have any more queries or if you want to consult me personally, you can do so through Lybrate.